Mm, mm, అడుగుతుంది. Yes, yes, yes. మన దగ్గర నుంచి
Pratima, whether we can start?
Good afternoon, ma'am.
Good afternoon. Good evening.
Sorry. Good evening, ma'am. Am I audible, ma'am?
Yeah, good evening.
Hearty welcome to Narayana Nursing Institutions, ma'am.
Thank you. Thank you so much for the opportunity.
Yeah, ma'am. So we'll begin within 2 minutes, ma'am. So
You will be sharing the PPT, no?
yeah. Yes, ma'am. The PPT is downloaded, ma'am. So I'll share from my side. Yeah. So let us, ma'am, all
I want to go back.
PhD scholars are
Hi
here.
to all.
They're eagerly waiting for you to say hi and say the greetings.
Hi, dear. Nice to meet you all. Known faces. They all are PG students or?
They are
One?
PG students, ma'am.
Okay.
The fresh batch students, ma'am.
4 to 5, it's pavam people are. 4 to 5, they have to go back home, no?
It's time to leave home, ma'am. But for faculty, it's the best time, ma'am.
Okay. I can understand.
Yeah, ma'am. Let me begin the program, ma'am, formally.
Start.
So good evening, one and all. It gives me immense pleasure to welcome you all the second day of faculty development program on digital health devices and applications, which is being organized by Narayana College of Nursing on behalf of Department of Community Health Nursing. I extend a warm welcome to our respected dignitaries, our resource persons and faculty members, and all the participants, those who are joining us both offline and online. Your enthusiastic presence truly makes this hybrid program meaningful and impactful. So before begin the sessions, let us have a brief recap of day one session. So which was taken up by the Usha Pannagnani madam. So madam has taken a session on telehealth and virtual care revolutions. So it was well understood by all the participants. So the session was mainly highlighted how the evolution of telemedicine and telehealth was taken place and how we are running up with the telehealth services, how to run up, how to motivate the students to use the telehealth services. So these are the topics were dealt by the madam. And as we are really happy with the madam presentations. And next day presentation, we are mostly waiting for you, ma'am. So let me introduce you, ma'am. So madam is Dr. Vijayalakshmi, ma'am. So ma'am is working as a principal of Savita Nursing Institutions. Let me brief about the ma'am. Yes. I'm trying to open your profile, ma'am.
No need to inform about everyone knows about me very well.
Yeah, ma'am.
Narayana, I'm
Your
familiar
profile,
only.
if you don't mind, let me just brief out, ma'am. I know that everyone knows here, but still, because we have already seen you for the national conference, ma'am. So where we had a good contact there. Let me brief about the ma'am. Ma'am has completed her PhD nursing from Dr. MGR Medical University. And ma'am worked as a principal, associate professors, and currently ma'am is working as a principal of Savita College of Nursing since 2024. And previously also ma'am worked as a principal of Tagore College of Nursing, principal of College of Nursing Cancer Institute. So in many areas ma'am has worked. I think the ma'am had more than 30 years of experience in this field. When ma'am has two world records, so which was the most blood pressure taken in 6 hours at Savita College of Nursing. So that was one world record. And the second world record was organized in International Conference on Multidisciplinary Research and Development, so which is ICMRD. Then ma'am has participated, joined in many national conferences and international conferences. And almost the papers were published more than 30 around. I think I'm unable to count all those publications, ma'am. If I read out, I think the 1 hour session will get over. So I don't want to occupy
No need.
session now. And apart from that, there are many awards. And I think by today's session, you could understand that madam would be the speaker and many. Yes, ma'am. I hope so. And madam has participated many faculty development programs and participated as a speakers in many conferences. And if you see, apart from that PhD, madam also has other academic credentials, that is post-basic course in operation room technique and management, so which was done under CMC. Madam also completed postgraduate diploma in values of healthcare, which is under Annamalai University. NABH standard for nursing excellence certificate. Madam was received that. And certificate course in essential of palliative care, which was given by the Indian Association of Palliative Care. So these are some of the other academic credentials of madam. So with all these introductions, so I would request you to take over the session of today's ma'am. So that is which is on M Health. Thank you, ma'am.
Thank you.
Over to you, ma'am.
Thank you so much. Everyone knows me in very well in Narayana, I believe.
Yeah.
I'm not a new person for you.
Ma'am, we are.
Whether you can share. Whether I am audible, my dear.
It's not audible, ma'am. Your voice is little low. I think we should.
Now it is audible.
Yes, yes.
Good evening to all. Shall I start?
Yes, ma'am.
Yeah, good evening to all. Nice to see you, everyone. And thank you for the organizer for inviting me for your FDP program. I'll be sharing a few things and what you know already. You can start sharing these slides. I don't think so. I'll be going with the slides. I know everything. So,
Ma'am, the slides already started sharing, ma'am.
okay, start.
Can you able to see me?
Yeah, I can see.
Yeah, ma'am.
So, mHealth, as per WHO, it is a technologically based tele-nursing, and also they recognize that communication technology, it will be bringing the health system to the doorsteps. That is the mobile health app is giving that. It's I was telling that it's a WHO globally. They are telling 121 countries adopted mobile health in the world, and also there is the billions of people benefited by this. It's a World Health Assembly brought into the regional committee. Then they are disseminated that the health is very evidence. So evidence based, the priority placed is a main role. And also the many resolution is adopted by the e-health because all the health system and the services has to be reachable, and also diagnostic procedures has to be reachable to the public one who is in need. The tool will be promoted person-centered care and integrated services to the delivery of health, good health to the humanity people. That is a motto of WHO and also the World Health Assembly. Be healthy, be mobile. That is the only one proverb everyone should be keeping in our mind. So I want to tell that. So the be a national forum is created, that it is a joint initiative of be healthy and be mobile. Even it is a preventive management and promotive management, non-communicable diseases and the risk factors, and improving the diagnostic procedures and tracking system, all those things and all, it's going on with the mobile health. So this is a brief introduction. The WHO is insisting on health and also the mobile health applications. This is only the technology based, nothing else is there. It's a technology based and human created one. It is a AI creation is there and human also created that. It will be helping the patient and also the healthcare providers to manage the condition, communicate through the online, streamline the healthcare services. If you want to get your psychological support, the someone will be talking to you and counseling will be given. So that is the way the health was developed. It is maybe a wellness type. It can be a lifestyle management and chronic disease management, mental health development, behavioral health apps. So many apps are there, and telemedicine is placing a major role in that. So key features, yeah, it is a very friendly interactive sessions. It will be having a strong security based real-time monitoring. We will be monitoring the patient from the remote area to the here, and assisting to the clinical decision supportive, and also the integrated with the wearable devices. Wherever you are, it will be giving you a insight into that. And it will be having a 24/7 assistance without placing any additional strain into the healthcare resources. So you don't want to have any strain, you don't want to go to the time. There is a delay can be assessed. Three delays. One is going to be a resource management setting if you are delaying, or maybe a diagnostic delay or treatment delay. All those things will be managed by the mobile health app. This is a brief introduction. I would like to tell that. Next slide, please. And this introductory thing, since your objective is mainly focus on smartphone application, help the patient and healthcare provider the managing the conditions. What condition the patient is there, and it will be communicating through online, streamline care delivery from providing range wherever they are in the globe. So healthcare related services will be provided through the health research. These apps are will be improving healthy outcomes. So I used to tell that it will be communicate to the online to providing the care to the people, one who is there on the wherever in the globe, and also to provide a healthy outcome. That is the mobile health app is objectives are created for that. So it is one more thing, the feature mainly we are focusing on. What is the next slide says that, and various types of health app is available. Everyone is using that. If you are not blinking the eyes, Whether anyone knows about that, there is a smartphone. If you are not blinking that, at least 11,000 times we have to blink our eyes per day. So in which, if you have a spectacles, it will remind you that you are not blinking now. Are we are blinking at least 11,000 times a day? I don't think so. No one is doing that. So it is an app was devised. It is a symptom tracking, physical activity, what you are doing, how many hours of walk you are doing, how many steps you are taking into that, whether you are sleeping properly or not, what is your heart rate, and also the calorie, how much of water you have taken, how much of calorie protein you have taken, and everything was given into that. Water intake tracking and monitoring will be given into that. So this is the features, so many features are there. Even the health education is given through that. So it will be symptom tracking will be there, physical activity and monitoring will be there. So many apps are available. This we will be seeing one by one. I think everyone is well versed about the mobile app and also the wearable devices. So one is the types of M health alone I will talk about. It is a wellness as lifetime management and lifestyle management things. We will be taking about the fitness app, sleep tracking app, diet app. So diet also will be monitored by that. And chronic disease, it is a diabetic management app is there, cancer care app is there, pain management app is there. So when there is in Japan, they were identified that when you are passing urine, the monitor will say that how many of sodium and how much of urea and creatinine is present in the urine. So that is the way they develop the healthy apps to the global level. And mental health app, actually we are not using the mental health app. Telemanasa is there in Tamil Nadu. It will be suicidal prevention app. And in case the students want, adolescents want any de-addiction things and all, addiction recovery app is there, stress relief app is there. You want to talk night, you are alone, you want to talk to anyone, you can communicate through that. There is a number is given to the each district wise. So that is the way that is they are helping out to ventilate their emotions. So that is a mental health app is coming into scenario after the COVID. So after the COVID, that is a, plays a major role. Next slide, it will be talking about the telemedicine and also the hello, anything I have to stop?
No, no, ma'am. I think that someone was unmute.
Okay.
I request.
Telemedicine consultation is there. So it is a virtual doctors are available in one area. From remote area, they will be operating and they can do it. So symptom checker, you can do it. And also the medication delivery services. In case if you want, you can provide online and also you can get the delivery on your remote area. So health monitoring in the next type of health app is there. It's a health monitoring medical devices and remote patient monitoring app. That is the only one advantage. We are having a palliative care center. We will be controlling in one area of Kanjipuram district. From Chennai district, we will be finding out the monitoring the patient's conditions. That is the palliative care centers we are running on that. And wearable device integration is there. So the patient will be monitored through the via CCTV monitoring, and any apps heart rate or respiratory distress is there, that will give the alarm, and the telemedicine people, we will be rushing to that area and we will be attending the patient within 10 minutes of time. So that is the app we are running into that in our health monitoring medical devices system. And home monitoring apps is there. So they can also provide the home care services wherever it is available. So these three is integrated into the home-based care. So any old age home, if they want, they can approach the people, one who is there, and remote patient monitoring. You can communicate with the hospital, tertiary care center. There, that people can be monitored that. So personal health records also it's maintained. Medical record management is app is there in all the hospitals. We have our MIAS in Savita Medical College. So all the hypertensive patients will be recorded. All the BP will be monitored. If you want to put the number, QID number or any numbers, if you put all your chronic disease, you can filter it. So like that, the app is run by the Savita management, and appointment schedule and reminders. This and all the tertiary care center we are monitoring. I believe that in your hospital also will be having this medical record and appointment scheduling and reminders are given in the government hospital also. Emergency and first aid app is there. First aid and emergency guidelines app is there. That will be given first aid management. It is like a health education, and location based emergency services app also will be provided by the and specialized people. That is maybe I can talk about one. If you are running the first aid management services, you can also create a lab and the people can be approached through that. So that is a way it is helping out. So wellness and lifestyle app, it is fitness app, exercise app, diet and nutrition app, what to take, which much the color, what calorie you want to take it, how much the workout you have done, what is a set of goal. And sleep tracking app will be giving you how much of amount interruption sleep is there. Are you a range of motion or a sleep is very good quality? When you are turning and tossing, all those things will be given by your sleep tracking app. Meditation and mindfulness app is there. How many hours you are closing your eyes and enable the user to manage the stress. How much you are managing on your own. So that is a mindful skill. It is given by the guided meditation. Stress reduction strategies will be followed in that. So women health app mainly tracking on menstrual cycle. That is every woman is going to be tracked for the fertility app, and also the pregnancy app is available. And smoking cessation, substance abuse, it will be given to the government system. It will be by the resources quitting the smoking. If you want to enrich that, it will be telling that not to do a quitting more things. And managing the substances, how much of nicotine is present in your blood, also monitored by the wearable devices. Nowadays it is like that, that's coming into the practice. And I would like to tell, these are the wellness app is there. More than that, it's available. If you want to follow that, you can do it more than this. And mental health behavioral app, next slide. Stress and anxiety relief. If you want to talk to anyone, support your stress, support your anxiety. Often relaxation technique will be taught to you, and breathing exercise will be taught to you by the people, and mood tracking will be given to that. So that is the way it is there. For there is a one device is available when you are taking inhaler. I think everyone knows that inhaler will be taken. So that it will give that how much the sensor, what is the breath, what is your what is your rate of breathing, and also the whether you will go into COPD or your lung capacity, everything will be monitored like that in the device itself. So like that the apps are coming. Depression management app is there, and also you can tell about the cognitive behavior. It is a self tool. You can even apps are preventable if you are using properly. And mood tracking system, according to your mood you can go for meditation. According to your mood system you can go for providers, you can go for depression, you can go for whatever the people you want, the resource persons, you can call those people. So cognitive behavioral therapy also, it is positive way. One is having a pattern of, you will be restructuring your positive thinking. So that is a way, it is a cognitive behavioral therapy and all, it's given. Addiction recovery app is used globally nowadays. They'll be tracking the people who is addicted towards sorbitry. Any so maybe a smoker, non-smoking and alcohol and everything will be taking into that. It's a journal, it was given that monitoring the how it is triggering, how the peer pressure is triggering going for addiction. These are the things and all is tracked by the addiction recovery app. And also the tele therapy app, if you want a mental health professionals to talk to you in online counseling therapy, you can call the people. There is a tele Manasa is available in Tamil Nadu. Like that, your people also will be approached. And for care, for more accessible, they are more convenient, and also the efficient people will be coming and talking to you. So this is the tele apps and all is there for health, mental health and behavioral app. One more thing, telemedicine and consultations. Everyone knows that there is a virtual doctor is available. Now the virtual nurses is also available, specialty based. So video consultation you can get through from that. It will be a convenient, medical advices will be provided, and also the comfort and at your doorsteps. Symptoms checkup, you can have a symptoms monitor with your pulse, BP, and also in your thing, and it will be diagnosed. If you put your BP, if you put your pulse, if you put your respiration, it will give you the health information, allowing the patient to educate themselves and they can go for diagnostic purposes. So like that, the symptom checker and diagnostic tools are used. And prescription and medication delivery, streamline of all your processes if it is correct. So online prescription is also available. It is convenient. The medications will be given to the doorsteps. So and also the enhancing accessibility, and also it is convenient to the people. So these are the telemedicine consultation is available. Health monitoring, everyone knows about the health monitor, remote monitoring, wearable devices. I don't want to talk about the wearable, social integrations and real-time feedbacks, home monitoring in elder people. These are the things and all is applicable in health monitoring and medical devices. Personal health record. If you want to store your health patients, health monitoring, personal health records. Next slides. Medical record management. You can store and manage your health record wherever you go. You can show your app. That is, you have to show your app, encouraging the patient to take more active role in managing their health. They want to monitor the glucose monitoring. They should have at least 3 months regimen with your thing, and they can show to that. And the patient will be wherever it is, they are going across the country, various healthcare setting. It will be helping out for diagnostic and treatment. Appointment scheduling and reminder. This is a common one we are using. Doctor's appointments and providing medication reminders and all. It's common apps is used for the personal health record and thing. I would like to talk about the women's health in maternity. Pregnancy tracking app, everyone will be following that. What is your first trimester globe and health education it is giving, what diet you have to take, what medication you want to take it, what is your, even your brazier sizes, how you have to improve all those things, inner cloth material, what do you want to use it, that and all will be given. Janam, that is one app is there. You can monitor to your milestones, how the fetal growth is developing, and between the doctor's appointment you can find out that. You can find out all your information about your pregnancy health and fetal developments. Breastfeeding and newborn care, mainly it's breastfeeding will be there for health and well-being app will be given, providing guidance for breastfeeding technique. It will be like a newborn care providers, and it will be providing the how to feed the baby, tracking your moment of care, when you want to wean the baby. All those things, health education will be given through this app. That is a women care app. Emergency and first aid app. This is a private app is there. Maybe Tamil Nadu government also has given Nam Mudalvan and other Mudalvan categories and all. It's a first aid emergency app. Ambulance will be coming to the first situations, emergency situation. It will analyze the situation. It will suggest appropriate to that. It's a nowadays it's a drone is available. Anyone has seen that? BLS kit will be brought by the drone. It will be giving you a automatic robotic BLS techniques. So that is the first aid emergency management is taking care on the globally. Location based emergency services. Location based in the sense, so in case in your district there is an emergency is there, in location whether the emergency app people are there, they will come and approach you. That is immediate assistance will be given in the emergency. Then the patient will be shifted to the other area. So these are the global apps available nowadays. So these many apps are there. Are we are aware about that? Are we are using in a right way? Whether it is secure to use it, how this app will be working out? Anyone will be tracking us. That and all is our in our mind. But that is very secure. Effective mHealth app is given by the authority. So we should get your licensure. Next slide, please. It is usability. It is intuitive to easy usage. It'll be accessible to all the people. Diverse users are there, maybe from younger to elder people, older people. Than the older people, younger people are very smart to use this one. I believe like that. And security is there, and very privacy is there, strong protection is there, and also the health data are encrypted with the authentications and regulatory compliances. All the compliances will be in confidentiality maintained, and personalization, it's a features or AI driven one. It is it's a AI based recommendation delivering tailored user experiences. If anything was not answerable, you can ask again for an expert opinion. Real time monitoring, it is a continuous tracking. It will give the alert. You have to come for your checkup next week. This is your appointment order. So, like that, it will be giving you an alarm for you. Remote care services, it will reduce the in-person visit and time interventions. That I told you very clearly. It will avoid the delays. 3 delays we will be avoiding in every time. When there is, it is a reaching delay is not time delays will be there. Diagnostics delay will be avoided, and also management delay will be avoided. So that is one thing is there in M Health. Clinical accuracy, if you are talking about the clinical accuracy, they are telling that it is the reliable, and also the evidence-based information support is saved. It is a clinical accuracy is there. So that is a one way of clinical accuracy they are maintaining into that. If any apps are not supporting, and extra apps also will be providing the information. So that is the way it is they are strengthening the every time apps. Integration, it is going to be a interpersonal permeability, and also the interoperability healthcare system. Compatibility will be there with wearable devices for continuous data tracking. So if you having the Apple devices, it will be more compatible with the Apple devices alone. If you are having any other system, you can also have the tracking allowance. So like that, the key features are there in M Health. So these are usable, security, privacy is maintained. So and also the authenticated to use it that. So I would like to tell the key features of some relevant one. It's a M Sugar. M Sugar, it's one more app, diabetic management applications. You can also teach the people how the day, if you are putting into your insulin or maybe your sugar level, it will be calculate and give you how much the insulin to be taken. So that's the way it is integrated. One convenient, you can top features of M Sugar bolus calculator is there. It will calculate your right amount of insulin. It will correct your meal time also according to your meal time. And this is a new app. It is devised. They are giving you a intuitive and paperless format, and everyone knows about that. It's a concise one. With your sugar, if you coincide with your app application, if you're showing your sugar level, it will give you how much the calorie you want to take it, how much the insulin you can take it, and also your dosage calculation will be given to that. This is a my sugar level one app is available. I would like to educate. And Talkspace is there. It is a one more application. Mental health services will be given to that through the council for the teens. So I want all the teenage to be aware about this. And the Talkspace one, it is a individual people and couple people want a counseling, they can approach. It is a, there is no money or nothing will be there. It is a user friendly psychiatric evaluation, diagnosis and medication also will be provided through the Talkspace one. This is a licensure one, don't worry about that. It's a confidential will be maintained in that. Ada Health is there. It is a symptom tracking system, symptom checking app. It is the health status will be assessed, symptoms will be assessed, decision about their health care will be given to through that, and also the peptide clinical decision support people. It will give the treatment pills. You want to have IV monitoring, you want to have an antibiotic, if you want other having any other medical dosage, that and all it will be calculated because this is used in the hospital setting. So these are the apps are we are using at present in our area. So I would like to tell that, or we are having all the apps to be there, we will become fool. I believe that once we will be started checking our weight, we'll be regularly checking that. That is our mindset thing. So we have to think about that which one to be used properly, which one to be avoided. So if you want, even the sleep disturbance is placing a major role for us. So challenges and conservation, we will be addicted towards that. Once if you want to check the sugar level, you will be addicted again and again, again. So data security and privacy, user has to be worried about that, but the breach will be there, misuse will be there. But you have to find out that strong security, authentication, compliances, and also the trust has to be created. So this will be regulatory compliances will be maintained by the authority. It's like a FDA people and GOPR people and HIPAA people will be following that. This HIPAA and other people are regulatory mechanism people. So you will be having that regulatory mechanism. Those people. Next slide, please. You can think about that, the regulatory people in the sense. So I would like to tell that regulatory monitoring people to breach about all your FDA. That is FDA people, how they are monitoring your other tracking ideas. So they won't do it. Food and beverages people and all, how they are monitoring the expiry date, food and drug administrative therapies. So like that, it is monitored by the FDA, and also the bias will be identified and regulatory app will be followed through that. So this you can find out that privacy will be there, security will be there, and credibility will be there, accessible, and also digital divide one, user adaptation barrier also will be there. It will be low technical skill people will be, if it is, I don't think so. No one is technically not skilled. Everyone is technically very good in technical skilled people. If technically, if you are not skilled, you are not learned. That is the one thing we have to talk about nowadays. It's we will be telling that. So this FDA food and how the regulatory mechanism, drug administrative people are following this one. So like that, it's a HIPAA people will be also maintaining the formula for that. How to follow the abbreviations. Health Insurance Portability and Accountability Act is there. Whether everyone knows about this act, we have a health insurance portability. It is a US funded law. You should know that it will be health information has to be protected. All your health information, if it is not protected, if it is disclosed without consent, you will be sued by the law. So this HIPAA is the one I would like to tell that everyone should know about the HIPAA app. So the HIPAA applications and also the accountability. GDPR, everyone knows about that GDPR. So I don't want to talk about the food and things. And GDPR, I will be talking about the GDPR. I would like to tell that how it is going to help about the medical abbreviations of GDPR, General Data Protection Regulation. General Data Protection Regulation. These are the regulatory mechanism app is available, and this will be getting the funded, and also it has to be monitored by the HIPAA, GDPR and FDA. This we have to get the address, we have to find out for the safety, we have to explain all those things, then only we can use this apps. So all the app to be registered by those people. These are the regulatory mechanism. Healthcare regulation will be monitored through those people. So I would like to tell that if you're going home also, if you are generating any app, so you have to submit your application or your patent to the HIPAA, GDPR and FDA. Then you get your application and it will be published and it will be into your product. So like that.
CTRA, like how we are registering our clinical trial.
Yeah, clinical trial. It is same like that. We have to get your applications through that. This is a newer thing I would like to tell everyone.
Yes. I think nowadays all of our projects are taken up on AI, machine learning.
AI, machine learning. Yeah.
So we should approach them and should get the permission, right?
Permission for that. Yeah. It is like a FDA, HIPAA and GDPR. HIPAA will be protecting with your legally. It will give you legal security for your apps.
Ma'am,
And
is it Indian based or foreign?
Indian based, foreign, US based is HIPAA. GDPR is applicable in all over the globe
World.
in India.
Thank you.
So these are the things and all I would like to tell that everyone knows about the apps, but how to use it, how to be providing healthcare, that is very important. And challenges, I used to tell that security, privacy, accuracy based, only the FDA people has to give the accuracy. It is accessible, everyone is accessible. User adaptation, it is your skill based one. Everyone is technically skilled. Poor integration, trust issue will be there, can be limited uses. I don't think so. Everything, good design has a good improving adaptations. That is a way it has to be improved. One thing key takeaway I would like to tell that what takeaway you will be going along with this. Don't be addicted towards your mobiles. Follow your regulatory mechanism, but you have to be a generation gap. I don't want to tell that Z people should not know about this, and maybe Zen people should not know also about that. But the younger generation will be a very smarter. So accessible healthcare, please disseminate your knowledge to the poor people, one who is not getting. That is a mobile app is giving you a democracy for health management, providing tool and clinical visits. It will be more expensive, equipment also more expensive, but the individual can be monitor the condition and receive the guidance. And we should be maintain your wellness, and also anywhere it is a smart, we will be connected to the smartphone. Well, how we are connected now, like that I don't want to come. The travel allowances is very maintained, and our management also will be benefited. And also I'm reaching everyone. So the same way, where how I am going to take the FDP there, instead of that I'm taking from my place. I'm also comfortable, you're also comfortable. So both the way it is accessible to the healthcare. One more thing is data driven insight has to be there. It's a continuous monitoring. We cannot tell that it is interrupted monitoring. It is a continuous monitoring. Comprehensive health will be there. Profile will be maintained. If you want to go for periodic checkup, you can compare with your previous record and how the dosage and how the previous any comorbid illness, it will be there. Whether you are having any antibiotic allergy, and proactive interventions can be comparison with that before complicating complication is develops. So this is a way data driven insight is given. Insight will be there in not in your memory, it is there in the apps. And privacy is the first one. I don't want to tell that the privacy should be breached, and user must be carefully evaluate the app. I told you all the FTP and FDA people, HIPAA people, policies, sharing the sensitive health informations. Nobody will share the informations in case if, related to the maternity care. I don't want to reveal anything to anyone. I don't want to tell my ovulation induction. I don't want to tell them my how many times I'm with the partner, whether I'm having a sexual protectiveness, and all those things and all will be having a platform. You can maintain the confidence one. So with the transparent data handling over the unverified application, please don't go with this. So that is a one thing I would like to tell, that it is accessible, but you have to use wisely. Unverified applications, don't use it. Whether it is a data driven insight, is safe. So four things you have to keep it in your mind when if you are empowering yourself into the mobile health. So mobile health is a good, I'm not telling it's a bad. If you are carrying out to your practice, it is a data driven is good. Whatever the data, if you want to show it, it will be coming to your paw. But if it is accessible to the healthcare, started with the mobile health, consult, research options will be given, but the data will be taken to the research, or you are giving approval for that. That is also you have to give the query. Configure setting as anywhere there. Are they are having connected with any other people breaching the our data? That and all we have to keep it in our mind while using your M Health. Thank you so much for the opportunity. If anything to be added, you please let me know that.
Yeah.
I'm ready to.
Yeah, ma'am.
I would like to tell that thank you so much for the principal one who is organizing the great innovative idea for and the organizing chairperson and Narayana College of Nursing people.
Thank you,
I
ma'am.
think I am disturbing you a lot.
No, 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 ma'am. Not at all. I don't think so. You disturbed and you made us really to understand the concept. I think those who are here also, they were really well understood. I think let me open for some time for open sessions for asking any questions.
Please interact with me, whatever the apps you are using.
Recently, when I was looking one of the pregnant lady when she is having the contractions, pains, so she was trying to note her contractions. So I couldn't get any apps. Actually, I tried a search in ChatGPT.
No
Well, to
apps.
note the contractions, also somewhere one app is there, ma'am. So there
Yeah.
you can count your contraction, how frequently the pregnant woman, labor woman is getting the pain. So the technology is really, we are really wondering ma'am, how fastly it's growing. So that's why it is called technology, I think. Whatever
Yeah.
it may be. So as we are in AI generation, the young generation must be approached of, should know all these apps, ma'am, really. Though we are anyway, our generation is going to be existed, not our generation. So next
No,
generation,
no, I am older than you, my dear. So
we are
don't worry.
also old ma'am along with you.
I am also old, 50
You can,
plus.
the participants, those who are in online and offline, you could raise any questions if you have. If you want any clarifications, you can ask. So madam is most experienced and expertise person. So madam will really clear all your doubts.
Are you are having any PhD? If you are creating any apps, you have to get your thing.
Yeah, ma'am. One of our, I think, faculties are PhD scholars under CMATs only. They are doing
Yeah,
development
yeah, yeah.
of AI,
So many
machine
people are
learning.
doing AI driven apps and all is there.
Their feedback was the scholars from the CMATs, Savita University, they are telling, no, our madam will not accept the simple studies or experimental studies. We must go ahead with the AI developed or something machine learning only. I know the PGs and the undergraduate students are itself taking up the research activities. We
Yeah.
got that from the CMATs more, from the scholars. That was really great thing, ma'am, because still we are not landing up with the STPs, PTPs, video assisted teaching. So those became outdated. I think by this your slide.
Oh, my dear, it is nowadays the rural people are well versed than us.
Yes, ma'am.
You may be thinking that the health awareness is not there, but the people are more awareness about our
I
things.
think they are knowing most than us, ma'am.
Yeah, better than us.
So that's when Narendra Modi ji has started the digital India. So almost we all will be in a digital.
Even the roadside shop people are not allowing money transfer. Only phone pay is there
Yes, ma'am.
and GPay is there. So they were well versed about their things.
All the apps and everything. I
It
think
was
even we can also start one of the our fresh MSc students are there, ma'am. They need to submit their synapses titles first. They need to submit. So based on this, they may submit the few of the titles. I expect. I hope.
please. Master students, and I was studying one article yesterday.
Yes, ma'am.
It's stating that in Japan, I told no, when they are passing urine, they are finding out.
Yes,
There
ma'am.
is a dog is having smell of the urine, they are finding out the cancer cervix.
Oh,
Whether you read the article, it was
it's
came in the
based on.
yeah, 5 years back I saw that one. And now yesterday I read about the one case, and there is a bed, there is a insects are there.
Hmm.
So to find out the apps, there is no one has find out that app. Whether it is app is available, I have no idea.
Regarding insects bite, ma'am. What
Insects in the mattress.
match? Okay, okay, okay.
Are we are screening that insects in the mattress?
No,
I don't think so. We are
no, I
doing.
don't think so, ma'am. I do.
One of my BSc nursing student
Ah,
last year passed out. He found out that and he started the startup also in
okay.
the scrub suit. We are wearing the scrub suit, no COVID time and other time and all theater, operation theater.
Yes.
It is an antibiotic layer is there in the skin, in the cloth.
Okay.
Okay. So in which case, how many times if it is a washable, also the antibiotic property will be present in that in the linen.
Oh, that
So
limit.
like, yeah, he found out that. And the mobile case.
Hmm.
If you're having the mobile is having more microorganisms.
That's true, ma'am.
Micro. In that mobile case, how much of organism is there? And mobile case is protected by the
Case.
antibiotic cases. It is
Yes.
like that. It is coming out in the specs. They are having blinking awareness alert.
Alert.
So
Okay.
like that, it is a blink. You have to blink for 11,000 times per day.
That's very
So
important for protecting our eyesight, ma'am.
eyesight.
The
No
doctors
one.
are blink, close eyes, do the exercise. So
And
better.
lacrimal duct is not secreting at all because we are watching every time screen.
Yes.
So we are having the risk of all those things, but the apps are giving you drink water. This is the alarm will come to your mobile.
Mobile.
Please drink water. This is the time to drink water. So
There are many uncountable. Yes.
yeah, so many apps are there. Even for sleep, it is telling.
Telling, yes.
So sleep, at 10 o'clock, I have kept the alarm. Your sleep time is coming. So it will be giving you every 5 minutes.
Yes,
And this is the thing, it's good for our thing because we are forgetting everything.
forgetting.
But our memory is going down.
Going on. The human knowledge is not being used. So full we are
Yeah.
dependent.
Everything we are
We
depending
need
on
not
the
depend
mobile.
on anyone. No one need to remind us. Everything will be getting through the mobiles. The
Nobody wants to talk, anyone. They want only four walls with one gadgets. They don't want to talk. They don't want a parents. They don't want a teacher. Teacherless classroom is coming. Master students, we are not going to give you advice. No teacher, no classroom. You can learn on your own. The mobile will be giving you all those things.
I
If
think the
you,
entire world in our hands, just with the
yeah.
mobile.
So exams also, it's an
So
app
what
based.
are our roles now in future?
I don't think so. The teachers' books and all, it will be vanishing. We are going to be a jobless people in future.
Yes,
So please get your alternatives ready.
we really had such a great conversation with you, ma'am.
Thank you so much. I think I have delivered a few things what it's supposed to be.
So formally, let me give a vote of thanks and thanksgiving from the Narayana College of Nursing. So thank you so much, ma'am, for that incredible, insightful and thought-provoking session. So your presentation was really, we were really, it's a very practical session. The session was, so we were very well understood about the mobile health technologies, how you have mainly highlighted their immense potential in transforming healthcare delivery. So the practical insights, the real world applications you shared will surely benefit all of us in our professional journey, ma'am. So on behalf of Narayana College of Nursing, especially Principal ma'am was busy with some meetings, so couldn't join with us, but ma'am told to convey her greetings, ma'am. So thank you so much, ma'am. Again, from bottom of heart from Narayana College of Nursing.
Thank you.
Yes, really, your pleasant smile, your pleasant expressions, so it made us very happy, ma'am.
Thank you so much for the
So thank you
opportunity.
so
Convey
much,
my
ma'am.
regards.
Yes, ma'am, surely.
Convey my regards to your principal, especially.
Yes, ma'am. Thank
Thank
you.
you all. Thank you all. Have a great day. Have a great day. Bye. Bye, dear.
Thank you.
Thank you, ma'am.